with the Locked and Loaded RN. If you're new to my channel, bienvenidos. And if you're one of my awesome subscribers, welcome back. Okay, so before I get into my video, don't forget to like my video, share my video, and subscribe to my channel. So today we're going to be talking about the pros and cons of being an ICU nurse. So if you've been following my channel, you know that my first job as a registered nurse was in the ICU. And so I'm going to do another video as to why I chose the ICU, how I got into the ICU as a new grad. But today we're going to be talking about the pros and the cons of being an ICU nurse in case you are considering to be an ICU nurse. So I have 7 pros and I have 7 cons. And I'm going to try my best to not go on a tangent. So I wrote them down. So if you see me glance down, it's because I'm looking at my book. So I think I'm going to do the pros first because I want to start with positivity. And then I'm going to hit you with a dose of reality, okay? So the 7 pros. Well, before I get into the pros, let me give you a little background. The ICU is the intensive care unit. So you're seeing the most critical patients in the hospital. Depending on how big your hospital is, some hospitals have ICUs that are broken down based on, particular things, such as the CICU, which would be the cardiovascular ICU. There's the SICU, which is SICU, which would be the surgical ICU. There's the MICU, which is the medical ICU. And depending on how big your hospital is, like for example, Boston General, they have ICUs for everything. I think they have a GI ICU. They have, it goes into every single department of the body has their own ICU. So if you're interested in a particular area, you can look for a hospital like that so that you only get experience in that area. Others have a trauma ICU. Once again, it depends on how big your hospital is. If it's a level 1 trauma center, level 2, level 3, and level 4. There's 4 levels. So if it's a level 1, you're going to get a lot of the gunshot victims that come there, stabbings. Maybe if it's a car accident, a real bad car accident, they'll get flown to your hospital, and you will see things like that in your ICU. So once again, there's pros and cons to if you go to a bigger hospital that has it broken up in different areas like that, because you get to focus on just that area and not really have to focus about the other things. Of course, it's good to know because sometimes one thing can lead to the other. So you have to have a kind of like a general knowledge about everything. On the flip side, when you work in a smaller ICU and it's a mixture of everything, you get to see a little bit about, know a little bit about everything. So you get to see GI issues. You get to see cardiovascular patients. You get to see patients that are in septic shock. You get to see maybe a gunshot victim. So it's a pro and a con to everything. All right, so now let's go into what this video is really about. 7 pros to being an ICU nurse. So number 1 is, this might be a biased opinion, but I feel like we are the best of the best. And when I say we're the best of the best, you have to think about it. In the hospital, everyone plays a role, right? The ER is known for working fast and for being sporadic. Everything is the front line, literally. The front line of the hospital is the ER. That's the first place where a patient is going to pass through, and then they're going to get transferred wherever they're going to go. So the ER is good for getting you stable, but as fast as they get you stable, the point would then be to transfer you to the ICU, because the ICU will be able to maintain that stability going forward. The ER to me is just good at getting you stable enough to make the transfer to the ICU or until a bed is available. So they're transferring their people to the ICU. Med-surg units, they're transferring, if someone codes, they're transferring them to the ICU. So in other words, to me, once again, like I said, I might be biased, but I feel like we are the baddest thing in the hospital because we're able to take on critically ill patients that other units are not really equipped to be able to deal with, especially for a long time. Once again, like I said, that might be a biased opinion, and I know some people are going to challenge me. ICU and the ER kind of has this little thing back and forth about who does more work or who's a better nurse. And once again, everyone serves an important purpose because the ER is the front line. They're seeing everything. They are encountered with more personalities than the ICU, I would say. So that's the pro to me. When I went to become a nurse, I'm the type of person where I love to pick the most challenging thing to take on. And to me, when I looked at all of the different areas, the ICU, there's a bunch of noise passing by. To me, the ICU would be the most challenging. And so that's what I wanted. That's where I wanted to be. Number 2, you get to master your nursing skills. So a lot of times in these other jobs that you could take in nursing, you hear people use the phrase that you will lose your skills. In the ICU, I feel like you don't lose any skills because you have to be good at IVs, you have to be good at CPR, you have to be good at assessment, a detailed assessment too, not just, listening to the lungs and no, like you have to have a good assessment skills. You're gonna be good at critically thinking. You have to be good at working fast. So all of the nursing skills I feel like are heightened in the being an ICU nurse. Number 3, the ICU is definitely not monotonous. So some jobs you go in and you have the same patients every day. You work the same wing every day. And although in the medical field things can change quickly or can turn quickly, more than likely you're expecting to have the day go smoothly. You do the same thing, you work with the same patients, and some people that works for them. Others will get tired of that. The ICU is a place that you never know. Your patient can be up and talking, and before you know it, they cold. You can have a patient that's doing really well hemodynamically, and all of a sudden in 30 minutes, you see them start changing. So it turns quickly and you have to be on your toes. The next thing is, more than likely, if you have your patient today, by the time you come back next week, you're not going to have the same patient there unless they're really, really sick and they couldn't be transferred then to a med-surg unit. So more than likely, you're changing your patients that you see. Unless you work like 3 days in a row, then you might be able to get the same assignment the 3 days in a row, or it might be similar. Maybe one person left and you have, the other patient from the day before. But it's always changing. And again, like I said, if you work in an ICU that has different, like a mixture of diagnoses, you're able to take care of patients with various diagnoses and learn. Okay, my camera chipped off on me for some reason. I don't know what's going on. So we were on number 4. Number 4 is the teamwork. The ICU has some of the best teamwork that I've ever witnessed in my nursing career. So one thing that helps the ICU to operate is everyone jumps in and helps each other out. So if, for example, you have an admission, by the time the patient is rolling up the hall, normally you have people that run in to help you with getting that patient settled, getting them off of the stretcher, onto the bed, getting their weight. One person will be hooking them up to the monitor. Another person might be helping put in an IV. Another person might be doing a finger stick. Everyone chips in to help you. They get your patient settled, and then they go about their own assignment. Another thing, for example, is if your patient codes. As fast as you press that code blue button, you're good. By the time your eyes are lifted up from the bed, there'll be about 20 people in your room running in to help you. And so because I think the patients are so critical, you can't have the type of attitude where you're just worried about your patients, because you never know when you'll need the team's help. So everyone tries to help each other out. Again, there's always exceptions to the rules. There's always people that come and want a lot of help, but kind of grunt when you ask them for help. However, for the most part, the majority of the staff that I've worked with in various ICUs have always been very helpful. And, they will help out with teaching you something or giving their opinion. If you're tied up in a room, by the time you come out, you'll hear people say, oh, I did such and such for your other patient for you because I saw you were falling behind. Now, again, are there exceptions to the rule? Of course. Have I worked with people in the ICU that haven't been helpful but loved a lot of help? Absolutely. But normally the attitude that people have in ICU is they know It's impossible to work in the ICU and not ask for help. Just turning your patients alone is going to require help from someone else. So it's normally best for you to be a team player so that you can ask for help later on. I've seen that in different states that I've worked, different cities that I've worked, I've seen that teamwork in the ICU is often better than in other units, or in other type of nursing areas. Number 5, time flies in the ICU. You're running a lot in the ICU. So even though it's a 12-hour shift, by the time you come in and you look at your clock again, it'll be 1 o'clock. By the time you look again, it will be 4 o'clock. Time flies. You might even realize, man, I didn't even eat lunch yet. I'm running. There's so much to do. So it's not the type of job where you're going to be sitting there looking at the clock and it's, no, you're going to be on your feet running. And sometimes you might feel like, man, I felt like there wasn't even enough time to get everything done. You have to pass it on over to the next shift. And likewise, when you come in, they'll have to pass things on to you. Number 6, I love the patient to nurse ratio in the ICU. I know for med surg, sometimes there's about 7 patients that you get. Likewise, if you work maybe in a long-term facility, it's about 20-something patients, 30-something patients that you're responsible for. Where in the ICU, you're normally 1-to-1 or 1-to-2. Very seldom if a nurse calls out or they're short, you might get tripled for the day. And that's normally a brutal day. A lot of facilities do not allow a nurse in the ICU to be tripled. However, when they do triple you, they normally give you patients that are doing the most stable out of everyone else on the unit. Or maybe people that are supposed to be transferred to the med-surg unit once they get a floor, and once they get a bed, So you're normally not with 3 very critical patients. So I love the 1-to-1, the 1-to-2. You're able to get a station in front of your patient's room. And although it's a lot that you are doing for those 1 or 2 patients, you're able to focus on these 1 or 2 patients. I couldn't imagine working with 7 different patients calling me, asking me for things, the families ask. That would overwhelm me. I've never worked on a med-surg unit in a hospital. I know it can be done because other people do it, but to me, I love that 1-to-1, 1-to-2. Number 7 is the action. If you want all of what you see on the TV with a patient coding and the compressions and CPR and all of that, you're going to get it in the ICU. Yeah, you could get it in the ER too, but you're going to also get a chunk of that in the ICU because, like I said, things change fast and there's always something going on. No day is like the day before. So let's get into the cons now. Number 1, I would say, is that you have to get accustomed to seeing a lot of death. You have patients that code on a regular and sometimes they don't make it. Sometimes they could be young, sometimes they just had kids, and it's very sad to see their families going through it when they come up to see them and the crying and the, everything, all the expected, understandable reactions. If you're the type of person that weighs you down and you're gonna carry it with you out of your shift, the ICU might not be the right place for you, especially when you have a lot going on in your own personal life. It might kind of, impact your outside of work life as well because it's just constant seeing death. Getting used to seeing a patient now, okay, they pass, do postmortem care, you get another patient. It's like nothing because it's a regular, it's expected in the ICU. Number 2 is I've worked in ICUs that only pay the nurses $1 more than the med-surg nurses. So again, to me, I feel like the amount of work that you do dealing with critically ill patients, in my mind, when I was going to become an ICU nurse, I thought that you would get paid significantly more because you're dealing with more critically ill patients. But some hospitals don't have any differential for critical care pay, and some only give $1 more. Number 3, like I said, is the running the whole time. Your feet on your day off will be killing you. You have to invest in a good pair of shoes, and even then, the next day you might not want to put your feet down to do anything. I know for me, I had this idea where I work 3/12, so the 4 days I have off, I'm going to do all these things. But sometimes the day was so tedious or so busy the day before that when I'm off the next day, the only thing I want to do is keep my feet elevated because I'm so tired. Number 4 is physically challenging. So now in nursing, you always hear people say to make sure you take care of your back because it's a lot of back-breaking work. Well, the ICU, do that times 2 because you have to turn your patients every 2 hours. You have, mind you, they're on ventilators, they're on sedation, so they're not helping you. You know, some patients can hold on to the rail to help you out when you turn them. These patients are, dead weight. So you're turning them every 2 hours. If they have a bowel movement and need to be clean, you're turning them completely to get the linen out, putting new linen in. If they're on tube feedings, tube feeding runs through them. So it's like a liquid stool where every 30 minutes they're going. And if you want to be one of them nurses that let it just sit there on the patient, it could cause their skin to break down. And once again, that will be on you because you're not doing your job. And so you want to make sure that you're on it to keep them as clean and dry as possible. Apart from that, you also have, like I said, doing compressions. It seems like fun when you do it once in a while, but doing it on a regular can mess with your shoulder. It's like afterwards you're sore after you do compressions. All that cute little stuff you do on a mannequin, in real life, you don't have that spring that's helping you. So the next day, your arm will be sore. So it's physically challenging. You're doing everything for this patient because they're unable to do it for themselves. If you have a patient that is able to move and walk and talk, they're able to shift or adjust in the bed when they're uncomfortable, they're not able to express that to you. So you have to do frequent movement for them or readjust them in the bed, scoot them up, turn them, because they're unable to do it for themselves. Number 5. So there's often limited or no auxiliary nursing staff. So I know a lot of times in the med-surg unit, you have techs that are able to help you out with everything that's not under the nursing role not the nursing role, because the nurses can do everything, they should be helping out doing everything. But let's say, for example, if I'm giving meds and a patient calls to use the bathroom, I can call the tech, hey, are you busy? Can you take the patient to the bathroom for me, please? Okay. If the patient needs to be fed, hey, can you feed the patient for me while I'm doing such and such? We're in the ICU. I feel like, I normally don't see a lot of techs in there. And if there is, there's one for the whole unit. Because a bulk of what you have is patients who are non-responsive. So non-responsive in the sense of that they're on sedation. So they're not talking. They're not normally getting up. They're on the ventilator. And you go around and you turn them every 2 hours, see if they use the bathroom, get the help to get them cleaned up. But a lot of the things that you're doing are things such as giving medications, dealing with the ventilator, dealing with the IVs. So you're not really able to delegate those things to others. So I think a lot of times people don't hire critical care techs to work on the unit. So you're literally doing everything. You ask another nurse for help with turning and stuff, but there's not really someone that you could delegate. Can you do this for me while I do this? Unless you ask a nurse, but they have their own assignment. So you don't really want to push your luck asking too much either. Number 6 is sometimes you run into egotistical attitudes. And I know that can be anywhere, but I feel like, again, because you're dealing with the people who are the best of the best in their area or in their specialty, you're going to run into the doctors who might try to talk down to you. You run into other nurses who feel like they are the best thing since sliced bread. And instead of being an educator, they try to belittle you. And of course, I think that could happen anywhere in nursing. But again, I just think that you get that a little more in the ICU because everyone wants to show how smart they are. And which is great. You have to be intelligent to be there. But yeah, you just have to check people when they get out of pocket. Check them with a smile, but check them because they will try to maybe embarrass you in rounds in front of other people or challenge your idea, and it's not in a helpful way. Of course, there's a way to do constructive criticism, and then there's another thing to just try to make yourself look good and the other person look bad. Number 7 is it's very stressful. So again, you're dealing with a high acuity of critically ill patients. So you just have to be ready for anything. You're not really coming in and able to have your mind zoned out doing something else while you're working, which I don't think any nurse should, but especially in the ICU, you have to be present. You have to leave your problems at the door and focus on this, because one little mistake, one little error, one slip up, of course, like I'm saying in nursing, that's all the time, but you're dealing with medications that can literally kill someone. Your actions that you do or don't do would literally impact someone's life. And yeah, like you just have to be on your toes because things can change in a minute. So that was 7 pros and 7 cons to working in the ICU. I love the ICU. The ICU will always be my baby. I left the ICU because I was tired of the 12-hour shifts in general. I love freedom. I thrive off of sunlight, and I felt as though being somewhere for 12 and a half hours just started to drain me. I couldn't even leave. You can't really leave to go on break because you have to be around, or for your lunch. You can run down to the cafeteria maybe, but you have to eat upstairs to be close in case your patient codes or there's any issues or any questions that they want to ask you. Where for me as a tech, I was used to going outside when the weather was nice to eat my lunch on my lunch break, talk on the phone, return. Instead, it was like you were stuck there in the break room with everyone, eavesdropping, listening to your conversations. You don't get a break to just, and I didn't like that. COVID was very draining for me in the ICU. So that also had me thinking to do something else. And like I said, just the 12-hour shifts, working weekends, working holidays, I didn't really feel like doing that anymore. So I changed to do something else. So I hope that this video was educational to you. If you're in school considering the ICU, I hope I gave you 7 reasons why you should consider it. And I gave you 7 things to think about prior to going into the ICU, the 7 cons. If you're a nurse already and you're getting burnt out where you are, continue to watch my other videos, because I'm going to share the other areas that I've worked in out of the ICU. I'm the type of person where I'm a dabbler. I like to go experience everything. And so I can save you some time, or at least give you some awareness before you go try these things out. If you're getting burnt out where you are, there are so many different options for nursing that you don't have to leave the nursing field completely, but you are able to go do something else that might be for you, or that might better suit you or your family life, or give you better work-life balance. So stay tuned, because I'm going to be talking about a lot of other jobs that I've worked and what were my pros and cons for them all. I hope this video was helpful to you. I'll see you next time.